Now let's talk about immunization financing. Ghana is transitioning from donor-funded immunization programs to a more self-sustaining model, raising concerns about the future of immunization financing. As the country aims to secure long-term sustainability, stakeholders, including traditional rulers and one beautifully dressed in the studio with me, I'll introduce her shortly, are advocating for increased domestic funding to maintain immunization coverage and prevent outbreaks of vaccine-preventable diseases. Now, failing to plan a smooth transition for immunization financing could have severe consequences. So without a strategy, the country risks losing the gains made in disease prevention, leading to resurgence of vaccine-preventable illnesses like measles and polio. So let's talk about this. Let's engage stakeholders on Ghana's readiness to transition by 2029. On Zoom with us this morning is Dr. Eric Insia-Boateng, and he's a health expert. Doc, hello, good morning to you. While we try and reconnect with Doc, in the studio with me is Mama Jitri II of Vli, and she's Vice President of the Hohwe Municipal Council of Queens. Mama Wezon. We also have Dr. Gladys Damalin. She's the Manager of Financing Immunization Advocacy Response. No, she's not a doctor.
Correction. Good.
Yes, thank you so much. So, ladies, welcome to the program.
Thank you.
Vli, Agoviepe. Yeah, Mama Jitri of Vli. Agoviepe. Wezon. And I think what you're doing is wonderful. Right, so let's get into the conversation. Let me begin with you. Doc, I didn't hear from you. Dr. Eric Insia-Boateng, are you with us?
Yeah, I'm with you. Good morning.
Great. Good morning. Well, Doc, let me start with you then. So please give us a background or an overview of the Financing Immunization Advocacy Response Project and its objectives in response to advocating for immunization financing.
Yes, thank you very much. And then when it comes to the immunization services in the country, we receive support from some of the development partners. For example, the Gavi Alliance. Over the years, we have had support from Gavi and other development partners to support the procurement and deployment of vaccines to the children in particular who need these vaccines across the country. That partnership started so many years ago, but if you want a bit of history, I think somewhere in 1974, through a World Health Assembly resolution, where member countries were mandated to put in place structures to start the deployment of vaccines to children who need them, or what we call to prevent vaccine-preventable diseases in the country. So from 1978, that is where Ghana officially, started the program. And as I mentioned earlier, we have had support from our development partners in this regard. Government is also contributing to it. As you can see, if you visit any of the health facilities in Ghana, especially what we call the public health facilities managed by Ghana Health Service, we have integrated the immunization services through the routine service. So it's not a standalone service that you will have to pay for. It's free of charge. So that is the way to go. I'm sure in the course of the discussion, we'll talk about some of the strategies that we put in place to finance immunization services. Thank you and over.
Thank you. So let me come to the studio. Gladys, how would you assess Ghana's current reliance on donor funding for immunization programs? What are the gaps that you've identified, for which reason you hope to, or you are in the quest to fix those gaps? What's the assessment?
Thank you very much. I think that, like Doc said, Ghana has been depending heavily on Gavi for immunization financing over the years. And we think that it is not sustainable. Why are we saying that? If about 70 to 80% of your immunization program is funded by the government, then definitely you should know that when the donor pulls out, you would have a lot of challenges. And basically, when it comes to co-financing, we know that there are some vaccines in Ghana that the government is supposed to co-finance with Gavi. And there are other vaccines that the government fully pays for. And so if Gavi is bringing in funds and expecting the government of Ghana to also contribute, and your share of that contribution is not coming timely, then there is a gap there.
Which is what has been happening.
Exactly. So let me give you an example. In 2022, if you will recall, there were some shortages in vaccines where mothers will take their children to the weighing center, like we usually call it in the local parlance, weighing center, to get their children immunized. And then they get there and they'll tell them that some of the vaccines are not there. Some of the vaccines are not there because the contribution that government is expected to make was not done. The whole year of 2022, government did not pay its co-financing obligation. They made that payment in 2023.
How much are we talking about?
I don't have the figure offhand, but I'll be able to release that figure later. But just to tell you that the whole year, you didn't make any payments, but you expect that your children should be immunized. Where would the vaccines come from? Because we need the funds to procure the vaccines from the international market. And it is a process. The plan is that by the first quarter of every year, government is expected to release its funding so that Gavi can plan and get the vaccines from the international market shipped down to Ghana. And you know that when these vaccines come to Ghana, automatically they have to move to the regional, the district, the sub-district level, and it takes a lot of time. It's a whole process. And so if you don't put in your funding early, don't expect that the vaccines will come on time. And that is where we'll be facing the shortages, and we know the implications of not immunizing our children. We'll talk about that.
I see this is very important. It should be important to all of us, the way you're speaking with fashion. And I know that traditional rulers like Mama yourself, you play some roles. And before we even talk about some of the successes you've chalked in this advocacy activities, what role really do traditional authorities such as yourself play in advocating for immunization funding?
Okay, thank you. In actual fact, like she said, we work with them, the traditional rulers. We work with the CSOs in order to have effective immunization programs in our various communities, or maybe even to the public at large. Because we have seen that it's very important, because when we as traditional leaders are able to help in the immunization, I think that we will have a healthy community, and then largely to the nation as a whole, because it's very important when we have a healthy nation. So that is why some of us are on board to become advocates for the immunization programs, because the children are our future leaders.
Yeah, they are.
So if we are able to target them well and then immunize them well, it will be to our own advantages, because there will not be spread of communicable communicable diseases will be eradicated.
Okay.
Yeah.
Thank you so much. But I would like you to share at least one success story, if there's any, on how you, Queen Mothers or traditional authorities leading the charge, especially for domestic immunization funding. Is there any story of such you want to share with us?
Oh, yeah. Like I said, we work with the CSOs.
Yeah.
And then when we meet at our various meetings with maybe stakeholders in various aspects of life, we discuss and then we bring it to bear on the government to be able to facilitate the payment of its co-funding for the immunization.
True.
And it's very important.
Okay.
Yeah.
Can I just add a little bit to what Mama said?
Yeah.
Yes, that we know that Queen Mothers are very powerful in our part of this
we listen to them.
We listen to them, and they wield a lot of power, and they have access to political officials and even decision and policy makers. And that is why they were targeted in this campaign or advocacy project, because we know that there are certain places that they can move in, I cannot be there. And with that access, they can really engage and make known to the policymakers and the decision makers what the gaps are and what they expect the government to do. And so that is why we targeted them in this campaign. And I think they are really doing well and
even
supporting
to add
the
to
campaign.
that, our people listen more to us because we are with them.
Yeah.
So when we speak with our voice, most often than not, it works with them.
Let me not even play the gender card, but we know that immunization mostly is left to the women, you know.
Exactly.
They're the
Yeah,
ones who are
yeah.
nurturing the babies at that
Exactly.
stage. So yes, they'll
Exactly.
listen to you.
Yeah.
But I mean, we understand that we are transitioning, right? From donor funding to more sustainable means. Now, failing to plan smoothly. And Doc, this is where I'm coming to you. I want you to help us understand that without a strategy, the country risks losing the gains made in terms of disease prevention, leading to the resurgence of vaccine-preventable diseases, illnesses, like measles and polio. So what are the likely consequences for Ghana if immunization financing is not sustained or improved over the next decade, so to speak? Dr. Nsia Boateng, you have to unmute for us.
Okay, sorry. I
Yeah,
think I've done
we can
that,
hear
yes.
you now.
So thank you very much. Yes, I mean, what you said is some of the shocks, if you like, that the country is likely to face if we don't put in place structures to ensure sustainable funding of vaccines, especially when we transition out of the Gavi partnership by the year 2029. So we need to put in place structures, which we have done. In fact, we've developed what we call the transition roadmap with support from some of the technical experts that we have within the sector, and then our stakeholders, the DPs, and then the CSOs. So that is what we are going to implement from 2024, the year that we are in now, up to 2029.
Okay.
So we need to do everything possible to make sure that when we transition out in the year 2029, we will be able to self-finance our immunization services. There are so many, interventions that we have put in place, and I have to say that I think the major issue when it comes to deployment or delivery of the vaccines, Ghana, we don't really have issues with that. The logistics, the capacity is there. And we even leverage that capacity during the outbreak of the pandemic, the COVID pandemic. So the key issue is the funding, which we are all working towards that. We have, for example, we have established the National Vaccine Institute. We are not there yet in producing vaccines locally. We would need support from other government agencies like FDA. In fact, FDA is the sole regulatory agency to accredit or provide licenses or give the green light for Ghana to be able to do that. As we speak, they are at maturity level 4 and level 3 according to the WHO standard. And they need to get to the maturity level 4 before they can or give green light to the country to produce vaccines locally. And that is where we are working with them to support them to do that. Once that is done, then the National Vaccine Institute can also come in and partner with other local manufacturers to do that.
Okay.
But aside that, a bit of the funding, currently government is co-financing its obligations through the National Health Insurance Scheme. There's an allocation through the NHIS that comes to the Ministry for procurement of vaccines to prevent vaccine diseases.
Right.
So that is the bit that we are doing. Currently, if you look at the proportion, Gavi is doing close to 80%, and we are doing less than 50%.
Well, thank you, Doc.
Okay.
For the sake of time, I want to get a key message that we actually want to get out to our people. And Gladys, so what would be that key message you'd like to convey to policymakers, stakeholder donors, and the public, really, regarding the importance of investing in immunization? 2029 it might look like a long way off, but it's very close than we think. Exactly. So what's the key message here?
Thank you very much. So my key message is that by 2029, 2030, Ghana will exit from Gavi support. And as a country, we have put in place the transition roadmap that is supposed to guide us to become self-sufficient in financing our immunization. I hope that we will stick to that roadmap that it will not just be a document, but we will implement to the latter whatever plans and activities we have put in that roadmap. And just to also let decision makers and policy makers understand that immunization, if we fund immunization as a country, we are rather saving cost because, in fact, we all know that some years back we're seeing measles, we're seeing chicken pox and others.
Polio.
Currently, scarcely will you see such diseases around. And I think that if we are able to fund our immunization, we rather save. I mean, research has shown that if you put in $1 to fund immunization, you get a return or an outcome of $67. So as a country that we say we don't have enough funds, where would you put in your little funding? Is it not in preventive than curative? And the old adage says that prevention is always better than what? Than cure. So we urge the National Health Insurance Scheme to put in more funding at the preventive aspect more than the curative part.
Prevention is always better than cure. Mama, I'll give you the final word. Okay. What would you like to add to this?
Okay, I am just appealing to the government. Even I wouldn't say national health insurance. I feel that the government must be committed to save lives, especially for the children, the preventable diseases that vaccines can prevent. I think we should invest more because even now, we, the elderly, are also benefiting from some of the vaccines. So government must make it a point to invest more in health of its nation.
Thank you so much. And I know that the conversation will continue till the end of this donor funding of immunization financing. And hopefully that all the strategies that you've laid out during this project can be implemented so that we go. But right before we go, Gladys, is there any acknowledgement, anyone you want to shout out, partnership, sponsorship before we go?
Oh, yeah, let me thank the Ghana Health Service, Ministry of Health, the development partners, the traditional and religious authorities, the CSOs, and all key stakeholders who have supported this campaign. Kudos to them. We thank them, and we know that we will continue to push till we see something being done about immunization financing. Okay. And also a very good morning to the Executive Director of Hope for Future Generations in the person of Mrs. Cecilia Senyo and the team. Thank you.
We cannot go without hearing something else from Dr. Eric Insiaboating. Doc, take us home.
Yes, thank you very much for this discussion. What I'd like to say is that we are committed to the strategies or interventions that we've put in the roadmap, where we need to partner with the private sector and both public as well to get support and implement all those interventions. We will do and then prevent, more mortalities and mobilities in the countries, especially for the population that we are dealing with, especially children that we are always targeting. So it's just an assurance that those strategies in the document will be implemented.
And that there is Dr. Eric Insiaboating, a health expert, joining us via Zoom. We also had in studio Mama Jitri II of Bli.
Agoviefe.
Hey.
You have to add
Agoviefe. Yeah. And she is the Vice President of Hohwe Municipal Council of Queens. We also had Gladys Damalin. She's Manager of Financing Immunization Advocacy Response. Many thanks for your time and for the work that you're doing for the country.
Thank you.
Right.
Grateful.
That's the end of this belt of conversation, but there's still more coming your way on the AM show. I'll be right back.